Then it's a Basketball Wives fertility exclusive.
If we can't have a child, I would have to let him go.
Could their relationship hinge on one visit to the doctors?
Can they get pregnant? Tami Roman is known for her outspoken personality, but what many haven't seen is the struggles she and fiancé Reggie Youngblood have been facing behind closed doors.
Reggie and I have been dating for about 2.5 years now.
It's been the best 2.5 years of my life. I never thought that I would find a woman that I love as much as her.
The best part of my relationship with Reggie is the amount of love and patience he shows me. However, we're 17 years apart. Reggie wants to have a child. I've already had 2 daughters. I've been there, done that. But when you're with someone that you love as much as I love him, you want to cross certain milestones with them. And so it's something that I'm excited about doing. We've unfortunately had 3 miscarriages. Not only are we dealing with this scrambled eggs that I have, menopause is knocking at my door, which is why I think a surrogate is the perfect way to bridge the gap. And we can pick the sex of the baby.
Please just bless me with a boy, please.
If the eggs are too scrambled to be delivered, I would not want to be selfish when ultimately someone that I truly love is not getting what he wants.
I'm not gonna wanna leave her just because she can't have a child. That's the woman I wanna be with.
I love Reggie today. I'll love him 20 years from today. But my love for him wants him to be happy. And if we can't have a child, I don't think he would be happy somewhere down the road. And so I would have to let him go.
After multiple miscarriages, Tami and Reggie decided they needed to take the next step in their fertility struggle, so we sent them to fertility specialist Dr. Tina Koopersmith.
I think us going through the miscarriages definitely brought us together.
Hi.
Hi.
How are you? I'm
Good, how
Dr.
are you?
Coopersmith.
Whenever it comes to going to doctors and stuff, I always get a little nervous because you just never know what they're gonna find.
It's been several months that you haven't had another pregnancy.
Right.
Do you have any medical problems?
Type 2 diabetes.
And are you a smoker?
I hate the fact that I smoke.
It is related to fertility. So 46-year-old women do have a difficult time getting pregnant, staying pregnant. It's gonna be really hard to grow your own eggs, to get yourself pregnant. But if you take someone else's egg and combine it with your sperm, then we have a 60% chance of having a baby. We'll do an ultrasound and look at those ovaries. This is for uterus. That's a little egg in waiting in there, and maybe in that one. So there do have some eggs in there, so that's good. You're actually potentially going to ovulate in a few days. If you want to try on your own, this would be the prime time. So the good news is you have eggs there, okay? Going forward, we should do blood tests to make sure we know what we're up against. I would highly recommend, if you're willing to chance it, starting today for the next week, you guys should go home and do your homework, okay? Okay, and maybe you'll get pregnant on your own.
Joining us with Tami is her fiance Reggie, and Reggie, welcome. I know this has been a struggle for the two of you. I want to ask both of you, what was it like and how did you feel after meeting with Dr. Koopersmith?
Well, at first I was depressed. I was like, gosh, she's a doomsday prepper, you know? She's telling me I may not have eggs, the percentage of this and the chance of that. But then after doing the exam and realizing that I still have 6 eggs, I had 6 eggs, you know, I was happy. And she also offered other options that we hadn't really considered. So, you know, I feel good about the process now.
And I'm glad to see that smile on your face. Joining us in the audience is Dr. Tina Koopersmith. I want to ask you, can they get pregnant?
That's a loaded question. She has eggs, maybe they'll grow. If they grow, maybe they'll make a viable baby. If they don't, there's egg donation. If medical problems interfere, there's surrogacy. So I think she has a great variety of choices. I'm optimistic that she'll be happy in the long run.
And I think that's an important point. I want to ask you, since there are these variety of choices, where are the two of you at?
Well, we're in homework mode.
Okay.
You know,
A whole lot of homework.
if we're not able to do it naturally, then we will consider harvesting the eggs. If that's not going to work, then, you know, we'll talk about having an egg donator.
I want to ask you, Reggie, how you feel about all this. And I will completely acknowledge that I was taken aback in your video when you said that if you didn't feel like you could give Reggie a baby, that your relationship would be over. And that was really hard, I think, for a lot of us to hear, because it's obvious the love you feel for one another. Reggie, I want to ask you about that.
When she says that, I'm not gonna allow that to happen, because I came into this situation knowing she was an older woman, and it was a possibility that she couldn't have my child. So for me to leave her because she can't have a child, that's selfish, you know. And I feel like there's other options I will consider. If she's unable to have a child, I feel like we can maybe go the adoption route, because this is the woman I want to spend the rest of my life with.
Keep us posted on everything, and we'd love to do an update at some point.
Absolutely.
And on this journey, we wish you nothing but the best. And Dr. Koopersmith, thank you for seeing them, and we'll keep everyone abreast, and stay tuned.